Hello, everyone. Thank you for joining us today. This is a Father-to-Father support group. Um, those of you who are joining for the first time, welcome. And those of you who join us every time, we appreciate your participation as always. Um, Father-to-Father support group is under the umbrella of Global Perinatal Services, a nonprofit organization that's really doing an amazing work, changing lives every day. Our organization's mission is to provide perinatal services that include doula services, lactation education, childbirth education, early parenting support, and child development. The communities that we provide services to are marginalized communities, which include Black, immigrant, and refugee communities. Um, we really appreciate all this work that the organization is doing. And today we have doctors who will be talking about men's health, which is really important that many of the members have asked to invite those doctors. And we really appreciate your participation. And as we noted on the flyer, there will be a stipend that we will be sent to you after the presentation, after the session. And please make sure that you have your name matching your email so we can send that to you. And before further ado, I will hand over to our doctors to pursue with their presentation. And if you have any question during the presentation, you can ask. And after the presentation as well, you can ask the questions and the doctors will answer your questions. Thank you so much for being here, all of you.
All right, thank you so much for the intro, Elias. And thank you to everybody for coming today. My name is Dr. Butler, but please call me Preston. And I have here with me Dr. Jaime Carrillo. You can call him Jaime. And we are family medicine doctors from Swedish Medical Center and Swedish First Hill Family Medicine. So we take care of folks all the way through their life, doing prenatal care, pediatrics, all the way through geriatrics and everything in between. Men's health is a super important topic that I'm glad we're here to discuss today. And Jaime and I just want you guys to know, please feel free to jump in at any time with your questions as we go through. You know, we have some slides just to give us a jumping off point for discussion, but really we hope that this can be an interactive opportunity for you to ask questions and discuss with us and with each other your experiences going to the doctor and talking about men's health. Without further ado, Jaime, do you have anything to add to that?
No, we're very lucky and very honored to be here. And the idea is for everybody to ask their questions whenever they want. So feel free to interrupt or do it at the end. And any question is valid. And please don't be shy to ask questions.
Absolutely. So a brief overview of things that we thought we could potentially touch on today. First of all, tips for having a successful doctor's visit. You know, going to the doctor is not always super clear cut in what to expect, what you're going to be able to cover. So we'll touch base on that. In men's health, often people have a lot of questions about things like erectile dysfunction that they're maybe afraid to ask their doctor. So we figured we could give a brief overview of that today. I think depression and anxiety are often not talked about enough, especially in men's health, and so we'll touch base on that as well as sexually transmitted diseases today. And then at the very end, we'll discuss prostate cancer and prostate cancer screening. If you have questions about lung cancer, we can add that on as well, but we'll see how much time we've got. So starting off, I'm kind of curious. I have a question for you all, for the group. So let's say you've scheduled an appointment with your doctor. Maybe you have a primary care doctor already, or maybe you're trying to establish with a new primary care doctor. What are your thoughts going into that appointment? What are your hopes, expectations, fears?
Yeah, and don't be shy, participants. You can ask the questions or you can answer the questions. Please go ahead. Feel free. to jump in. I think a lot of people that I've spoken to have expressed fears of being diagnosed with you know, a disease. And some of them, they would say, you know, I don't want to go to the doctor because if I go there and I get screened, I may get diagnosed with something that, you know, some disease that I'm afraid to get. So that's one of the things that I hear from people.
Mm-hmm.
That's a very valid fear. Absolutely. I guess when people go to the doctor, what do they hope to achieve? Are they hoping to talk about something that's immediate, or did they hope to talk about maybe things that could happen in the future?
In or you know, I speak to a lot. They ask questions since I work with doctors. You know, what is this? And they ask me questions, and I tell them you should go and see a doctor. But this is what you and one of the things that they only go when they get sick, and they hope to, you know, to be cured, of course, when they go to the doctor's appointments, and they hope to, you know, get treated and get cured from whatever they have, right? A lot of people don't normally go to preventative exams, but mostly.
And then Zainab mentioned people might be concerned the doctor will not be culturally competent, and there's also mistrust. Those are very huge things too. Agreed.
Correct. Yes.
Wow. Well, in order to make that first appointment or that follow-up appointment a little more clear on what to expect, we wanted to put together a little overview of, you know, tips to have a successful doctor's visit here. Sometimes people may not have a primary care doctor before, and so they're going to a new patient appointment. And I apologize that this slide particularly has a lot of text. I wanted you to be able to refer back to it later if you have a new appointment somewhere. At your first appointment with a new primary care doctor, generally you'll just have a chance to get to know each other. You know, if you have had some mistrustful experiences with medical professionals before, this is a great opportunity for you to see if this is a doctor that you would want taking care of you. It's kind of an interview in a way. You are trying to determine if this clinic and if this provider are going to be able to meet your health needs. Likewise, it's an opportunity for them to get to know you. Where do you come from? What do you do on a daily basis? What is your job? In addition to what medical conditions have you been treated for before? What surgeries and family health problems run in your family? What are your health goals? And then, you know, the logistics, I guess, of, you know, do you take any medications? What are those medications? It's really helpful if you can bring a list of those medications, or even just bring the pill bottles with you to a first appointment. And then I just want people to know it's helpful if you can bring, you know, your insurance card and your ID, because the front desk will always ask for those. And then in order for your doctor to be able to access any prior records, make sure you bring the names and addresses of your prior doctors if you've had them either somewhere else in Seattle or somewhere outside of Seattle. Those new appointments have a lot of discussion. They tend to be a little bit longer. Follow-up appointments, if you have already seen your doctor about a problem and you want to touch base about it or talk about a new problem, those are usually a little shorter, and it helps to come in with an agenda of things that you hope to talk about. Your doctor wants to make good use of your time together and help you with a problem, be able to discuss it thoroughly instead of just skimming the surface. So it's helpful if you can talk with your doctor about what you hope to accomplish in that visit at the beginning as it starts. So I recommend bringing a list of your questions, bringing, you know, 1 or 2 things that you hope to discuss and accomplish in that day. And then The third type of visit you can have with your primary care doctor is like an annual wellness visit for preventive care services. Huge difference here that I want to highlight is with most insurance plans, including Medicare and Medicaid, if those are your insurance companies, this annual preventive care visit is free of charge to you. You will just discuss your wellness, cancer screenings, vaccinations, diet and exercise. It's an opportunity for you to make sure that you stay healthy in the future, in addition to in the present. And we can go through some of those other cancer screenings later. Anybody, if you want to chime in about your experiences, maybe going to the doctor and not knowing whether this was going to be a wellness visit or a visit based on problems or whatever, feel free to chime in with your experiences in the chat or just interrupt. But in general, if I had to summarize a couple just quick tips, arrive 15 minutes early to your appointment. That way you can get checked in, you can go through all of the new health forms, like new patient health forms, because there can be a lot of paperwork at a new patient visit. Bring a list of your questions. And then I just want to emphasize that primary care is about having a long-term relationship with a provider. When you go to meet somebody, you're interviewing them in a way to determine if this is who you want to help take care of you and coordinate your care long-term. So that when you do get sick, you have somebody in your corner that already knows you, knows your family, knows what you do on a daily basis and where you come from. And that will help you get better care and have to explain less to the provider that already knows you.
So when you are in one of those new visits or problem visits, we want to acknowledge that problems related to men's health can be difficult to talk about, especially depending on the culture, where you're from, your religion, the type of family structure you have. So it's such a personal thing to bring problems to the doctor. And I think when you share them, doctors typically feel very, very thankful because it's not easy to talk about that. So I think one of the other big points we want to share with you is that we want to encourage you to, over time, with this relationship that you're hopefully are trying to build with your doctor, to share over time things. We acknowledge that it's not going to be a one visit and you're going to share everything, but it's going to take several visits to start sharing things, and we might not even happen in the second or third visit. So I think whenever you feel comfortable sharing those things with your doctor or your nurse or whoever you want to talk to, that's okay. And you're the one that kind of makes the decisions and dictates the pace in which you are gonna get your health. Okay, so first topic is sexual dysfunction. And I am curious, again, this is a very personal topic, but I wonder if people have had experiences with any doctors sharing about any type of sexual issues that they faced in the past or currently. And if you don't, that's okay, because we're going to talk about them. Sexual dysfunction, if you can imagine, is mostly like an umbrella term. So there's a lot of conditions that we can put in sexual dysfunction. It's very common in people in their 40s. And the thought is that as you age, after each decade, so after your 50s, 60s, those problems are going to become more common. There's three of them that I thought we could talk about. One is erectile dysfunction, which is you're not able to sustain an erection or sufficient rigidity during your sexual encounter. The other one is decreased sexual desire, which the medical term is libido, but it's basically decreased sexual desire. And then the third one is any problem with ejaculation. So either you ejaculate before or you ejaculate after the sexual encounter, or you might feel the sensation that you're ejaculating, but nothing comes out. So those are issues that can affect, again, any person, especially as you age. Now, thinking about all these three things that we just mentioned, there are things that you can do on your own, and there's also things that you can pay attention to that if you do, you might think to yourself, maybe this is a risk factor. And when we say risk factor, meaning this is something that over time can contribute to one of these sexual problems. For instance, people with diabetes, meaning people with elevated sugars, people with heart disease, kidney disease, people who have issues in their sleep, snoring too much, and maybe when they wake up, they don't feel very rested, people with high blood pressure, also people who smoke, and also depression. So the biggest question is, should you see a doctor or a nurse to talk about this or start a conversation about this? And if you're not sure, I think it would be important to do that. So the answer would be yes, because these are things that we can help you with. In the image, you can see some of the things that you can do, but there's medicines, there's devices that can be implanted on the penis. And because some of these issues can also are related to, for instance, anxiety or depression, talking to somebody. It doesn't have to be a therapist. It doesn't have to be a doctor. It can be your partner, or somebody you feel close to, that you can talk to and can help you start maybe feeling more comfortable about this. And I'm going to pause here. Does anyone have any questions about any of these risk factors or things that we can offer you or help you with sexual dysfunction?
And I'll also add, if anyone has heard any myths about erectile dysfunction that they would like to share that we can talk about, that would be great.
Yes, participants, the doctors are encouraging you for you to ask a question. If you speak Somali, you can speak and I will be happy to interpret for the doctors. Please feel free to do that. Because it's not, as the doctors say, it's very uncomfortable to talk about issues such as this, but it's also, people shy about it, people embarrassed about it, but it's things that we live with in a day-to-day basis. It's something that needs to be addressed if you are experiencing, and that's the only way that you can get the help that you need, so you can be good for your family and for yourself as well. So please feel free to ask questions, and again, you can write in the chat or say something, and if you speak Somali, I can interpret for you.
Or
You can
Spanish.
send it to Elias as well privately. That too.
Exactly. Yeah, you can send me to me privately, and then I can ask you that. Okay.
We have something in the chat.
Yeah. Someone is asking if stress can cause the sexual dysfunction. Thank you. That's a very good question.
Yeah, stress can definitely cause sexual dysfunction. It's probably thinking about if stress is contributing to, for instance, depression, or if it's contributing to anxiety, then it can definitely cause this sexual dysfunction. And we're going to talk a little bit more about the depression part, but yes, it could be contributing to that.
And I'll also add to that, when we feel stressed, stress affects our relationships with other people around us, with your family, your friends, and with your partner, including your sexual partners. And so that can definitely affect and contribute to sexual dysfunction. Great question.
All right, depression. I want to poll everybody. What do people know about depression? What is their understanding of depression? And have they ever heard about this word before? Maybe people have not heard about the word before, and that's okay.
Yeah.
Depression, it's a disorder that can make you feel sad, but this is a little bit harder or different than a normal sadness. With depression, it's usually over a period of time, and we're gonna see in a little bit what's the period of time. But it's usually a little bit, if you think of like a stronger flavor of sadness, that's what depression is. And it has to do with we call them neurotransmitter, which means a little chemical in your brain. And those chemicals can be a little changed. And so you might have, among other things, sadness. You might have trouble working. You might have trouble enjoying the things that you usually like to do. For instance, if it is taking your children to the park, if it is getting together with your family members, with your friends from your same country or community. Those are some of the things that you might or might not even notice. Actually, a lot of people don't even notice these things, and it's friends or family members who start noticing this. And then a little bit stronger too, thoughts of being dead or not alive. And those thoughts in depression are very normal. And we'll talk in a little bit about what to do if you have ever thought about that. And then another big takeaway home point is anyone can have depression. Depression doesn't discriminate between gender, where you're from, how much you earn, and depression can happen to everybody, especially if you come into a new country, if you don't know the language, if you don't know how the healthcare system works, if you have, basically, if you experience any trouble currently or in the past, you can have depression. And it's very normal to have depression. So for the depression, we think about, you should try to ask yourself if for the last 2 weeks you felt one of these two symptoms: no longer enjoying or caring about doing things that you like to do. So when I mentioned like going to the park with your children, if you have children, or with your dog, or with your community, and then feeling sad or hopeless, or sometimes even cranky most of the day. If you feel like you have one of those two, then I think it would be a good idea to reach out to somebody that you feel comfortable with, including nurse or doctor, if you feel comfortable with them, and reach out and tell them these feelings that you're having. And I know it can be very challenging and very personal to do this. And so let's say you come to our clinic, Dr. With Preston's clinic or my clinic, and we see you at, let's pretend, on Monday at 9 a.m. We will probably ask you a couple of extra questions about how you're feeling. We'll probably also do an exam, and we might also order blood tests, because we also have to make sure that there's no other issues causing this depression. There's a question saying, is there a distinction of depression in the way that it affects men and women? I would say no. I think, though, each person who experiences depression has very personal symptoms. But in general, each person has a different reason to be sad or to feel cranky or to not be interested in doing the things they like. But in general, depression is going to affect men and women. And people can have different kind of flavors on how much they get affected by it. So it's not really by gender. Do you have anything to add, Preston?
Yeah, I was just gonna say, I agree. Depression can happen to anyone. It doesn't discriminate by gender. I will say that sometimes I feel like as men, we are encouraged to hide our emotions or to be strong and not show if we're feeling off or anxious or sad in any way. And so sometimes I think we don't talk about it a lot. You know, in men's communities, if people are feeling down, we're not encouraged to talk about feelings. And so it can be harder to recognize, I think, among friends if you're not talking about it as much. But at its core, yeah, depression and anxiety are going to affect men and women in exactly the same way. Great question.
Yeah, great questions. Thank you. So some of the things that we might suggest are medication, talking to a counselor, talking to a friend if you prefer that. And then in a little bit more stronger cases or more severe cases, they can become an emergency. So that's why it's so important to try to reach out to anybody about any of the symptoms, because it can become an emergency. Oh, next one. Thank you.
Okay.
Can I ask a quick question before
Yeah,
you move on?
please.
Yep.
Yeah, so sorry. Yeah, I was just gonna ask, how does depression affect more to people with prior trauma, like civil war, childhood traumas? Is that does that affect more, or will they be prone to getting depression when they experience those traumas in their lifetime?
Yeah. When we think about if you have experienced any type of trauma in the past, a lot of people deal with it in very different ways. Some people might pretend it never happened. Some people might not want to talk about it. Some people might talk to their family or their partner about it, but not to a doctor. And then some people might be very vocal about it, and be very open about it. I think if you have experienced any type of trauma in the past, you can be at risk of having depression because of that trauma, whatever it was. If it was a civil war, if it was being separated from family, whatever trauma you had in the past can continue, and you might not even notice it when you are a teenager, an adult. And some of the symptoms, like we just saw, you might just be cranky for most of the days, or you might just not want to go to work and you're not really sure why, but you're still thinking about the trauma that you had in the past. And so in short, the short answer, yes.
And Elias, that question brings up kind of a completely different but related mental health condition called PTSD, or post-traumatic stress disorder, which folks may or may not have heard of. But basically, when people experience significant trauma in their life, often, regardless of whether they want to talk about it or not, sometimes people can continue to relive those moments and find that they are reminded of that trauma in their daily life when they're maybe trying to avoid it. It can affect their ability to focus on things. They can have specific flashbacks based on something that they see or something that they hear that brings them back to the moment that that trauma occurred. They could have nightmares about it, really affecting how they sleep. And so if they have those kind of intrusive thoughts and flashbacks and nightmares, and they feel really on edge, maybe like a heightened sense of awareness of their surroundings because something so horrible happened to them, or they witnessed something so horrible, then that is post-traumatic stress. That's post-traumatic stress disorder. And, labeling it as a disorder is just something that we do to be able to talk about it and identify it. For some people, it's not helpful to have a specific diagnosis, and that's fine. It just helps us think about treatments that generally help for people with PTSD, which can include therapy and medications, if desired. But that's a decision you can make on an individual basis with your doctor. I would say if you have questions about that, it's good to just start a conversation with a doctor about it, because that can be really, really disruptive. And people that have experienced significant trauma, I think, it's hard to ask for help, and it's hard to acknowledge what's going on, because it makes you relive those moments even more. But the goal of asking for help is to not have to continue to exist in that way. So yeah, that just raises a great point about a whole other kind of related topic.
Thank you so much, Dr. Butler. Thank you. Yeah, that's helpful.
Okay. If people have comments about that, please feel free to chime in the chat. No topic of discussion is closed once we change the slide. Okay. But next we wanted to kind of give an overview of something else that's really hard to talk about, but that is very common and can affect a lot of people, and that's sexually transmitted infections or sexually transmitted diseases, STIs or STDs. People use both terms interchangeably. These are infections that are transmitted from person to person through sex, through oral or vaginal or anal sex. They're very common, but they're hard to talk about. There's a lot of stigma, or there's a lot of shame around having an infection like this, when in reality, it's really not different than having a cold or having pneumonia or some other infection somewhere else in your body. It's just an infection of the parts of your body that we use to have sex. Some examples of this can be gonorrhea, chlamydia, syphilis, HIV, and herpes. And if folks have heard of others, there are a couple others that are a little less common. So I decided we wouldn't probably touch on those today, but if you have questions about them and you know of others, then please feel free to chime in. Basically, I have a lot of people ask me when they come into the doctor, and I ask them, do you want STD testing today? They're like, well, I don't think so. I don't know how I would know if I had an infection, Maybe I've been with the same sexual partner for a while, or maybe I've had sex with multiple partners, but I've never been tested before, and should I be tested? And I think the first thing to address here is, when you're having symptoms, yes, we absolutely should test you. Go see the doctor. If you already have a doctor, sometimes you can just ask them to order STD testing. And sometimes STD testing is available. Well, not sometimes. STD testing is available for free at some other clinics throughout the city of Seattle. The one that comes to mind immediately, and that I'll talk about here, is the King County Health Department's sexual health clinic at Harborview. So if you Google free STD testing Seattle, that should come right up. But if you were having some of these symptoms, then you should definitely think about maybe having a need to get tested. If you notice you're having burning pain while you pee, that could be concerning for a urinary tract infection or a sexually transmitted disease like gonorrhea or chlamydia, including peeing really often or peeing more urgently than you used to. Like all of a sudden you feel the urge, you have to go right now. There can be changes to the skin sometimes with things like syphilis and herpes. If you notice any small open sores or large sores, if you notice some bumps, that could either be just like bumps of skin or filled with some fluid, and they drain. Those can be painful or not painful, depending on the type of sexually transmitted infection you have. Or if you have sex with someone that then tells you that they just tested positive or that they just had an infection with a sexually transmitted disease. Sometimes people can have an STD and it takes a couple weeks to appear, to start causing symptoms, even though they were carrying and could transmit the infection at that time. Think about my analogy for this, my similar comparison here is actually with COVID. You know how with COVID, before people start having symptoms of a cough, a cold, a headache, they can still already have COVID and be spreading it to other people. Of course, they're more likely to spread it when they do have symptoms, but you can have an infection before symptoms appear. Can be the same with STDs. But if you had sex with someone and then later they tell you that they tested positive for a sexually transmitted infection, then you should absolutely go get tested if you've been exposed, to get early treatment and avoid symptoms yourself, and then prevent the spread of these infections as well. So, how can we prevent getting STDs? Well, the first thing, and something that you've probably heard before, is with condom use. If you're using your penis to have sex, then we definitely encourage use of condoms. Condoms cover the penis and prevent transmission of any fluids, like from your semen or from fluids in the vagina, to prevent transmission of sexually transmitted diseases. Of course, condoms also are fairly effective at preventing pregnancy. So this is just an extra benefit. Of course, if you and your partner have both been tested, you're in a relationship only with each other, not having sex with other people, then there is no risk of transmission of a new sexually transmitted disease. So options for condom use in a relationship are very individual, but if you're not in a relationship and you may be having sex with multiple partners over time, over the course of a year, like having one relationship and then another in the same year, then I would definitely encourage condom use in sexual encounters. And then getting regularly tested. Often people will get tested for sexually transmitted diseases at the beginning of a relationship or after having a new sex partner, so that they understand whether people talk about their status, like, do I have gonorrhea or chlamydia or not? Do I need to get treatment for anything before I have sex with this new partner? Regular testing is important to help prevent the spread and to detect things early before they're a problem. And then talking about it with your sex partners is really, really helpful. It can be a difficult thing to talk about because, like I said, there can be some shame and stigma around sexually transmitted diseases. But we're working hard in the medical community to remove that stigma. Like I said, an infection of parts of your body that you use to have sex is really no different than an infection of your lungs or of your skin. And so talking about it with sex partners, when did you last get tested for STDs? Would you like to get tested for STDs together? Maybe we can both do that before we have sex with each other. Is a great way to both protect your partner and protect yourself. And that's really a great form of caring for yourself and caring for that other person, to make sure that you both stay healthy.
Here's a question in the chat. What is the effect of these diseases if not treated?
Yeah, excellent question. It really depends on the specific infection. So I'm sure folks have heard of HIV. You know, HIV can have very serious consequences. I will say that HIV is transmitted through sex or through blood. If you're exposed to someone else's blood and it mixes with your own. HIV is not transmitted through saliva, like through sharing a cup with someone or through someone's spit. HIV is not transmitted through oral sex either. It typically has to be a penis in vagina or anal sex. That can have serious consequences on your immune system and requires long-term treatment with medications. HIV has a lot of health complications, so I'll kind of leave it there, but we can talk in more detail if people are curious. For gonorrhea and chlamydia, these infections are very treatable with antibiotics. They often just are pretty inconvenient and cause a lot of pain. You know, you can have pain with peeing. You can end up having some discharge from the penis. And the infection can travel up through the penis to the prostate, which we'll talk about in a minute, and can cause some pain in your pelvis, like in your lower body as well. Same with chlamydia. These can also cause a sore throat, fever, but are treated with antibiotics pretty routinely. In women, for people with a uterus, if gonorrhea or chlamydia go untreated for a long time, then there is a risk that it could impact someone's fertility, someone's ability to carry a child or to get pregnant. That's not very common, but it is a concern because it can cause an infection for a long time inside the uterus can cause some scarring that makes it more difficult for that person to get pregnant. So that's also important to think about in terms of both keeping yourself healthy and keeping your sex partners healthy. And then syphilis similarly can be treated with antibiotics. Syphilis long-term can have significant health consequences. It can cause a rash and some damage to your heart and your blood vessels, but that's only if it goes untreated for a long time. And so that's, again, why it's really important to get screened to prevent those things. People may not know if they have syphilis because it usually causes a sore on your skin that's not painful. And so people may be hesitant to get screened if they experience that. And then herpes actually doesn't have really significant consequences. It's just inconvenient and it can be painful when you have a flare. Herpes is a bumpy rash on the skin. You can take a medicine that prevents the virus from causing outbreaks and keep it well controlled. That's kind of an overview. I can go into any of those in more detail.
That's a great review. There's another question. Can it affect baby if the woman is pregnant? And I'm not sure if this is referring to syphilis or any other diseases, but in general, with syphilis, it can affect baby. Same thing with HIV and also with herpes too. They can be passed sometimes when the baby goes through the vaginal canal. Baby may acquire, because it's sometimes, let's say with herpes, can be skin to skin. So baby's skin with the vaginal canal, you can transmit the herpes, for example.
Yeah. And so actually when someone comes to Jaime or myself and they are newly pregnant and they want to establish prenatal care, we actually screen them for all of these diseases at the beginning of their pregnancy, so that we can appropriately treat them before delivery.
Yeah. Oh, another, I think, important point is if somebody tests positive for any of those diseases, I think common practice is to not only treat the patient, but we might also, it kind of depends on the state, but treat the partner to, or offer the partner to come to clinic to seek treatment just because your partner is maybe have tested positive. So just because maybe you haven't found a doctor or nurse to treat you doesn't mean that you can't get treatment. You can go to multiple clinics and say that your partner, like it says in this slide, tested positive, and you can receive treatment.
Mhm. Okay, like I said, feel free to keep the questions coming, but I'll move on and talk just briefly about prostate cancer. The prostate is kind of a confusing organ, and people have probably heard that word before, but may not know where the prostate is or what the prostate is or what it does. So I'll just start by saying the prostate is an organ in people with a penis that is basically between the penis and the bladder. So bladder is where pee is stored, where urine is stored, and it passes out through the penis. The prostate is kind of around that passage right underneath the bladder. It is important in producing some of the fluid that goes into semen or into sperm. And yeah, that's just, I can explain a little bit more, but I do want to talk about prostate cancer. Prostate cancer is, of course, a cancer that only men get, only people with a prostate get. It usually can appear later in life, and it has a pretty wide variety of how it can affect people. When people get certain kinds of cancer, like pancreas cancer, pancreatic cancer, it's usually a pretty serious diagnosis that may, unfortunately, mean they only have a couple of other years to live. It's not always successfully treated. Same for things like lung cancer or colon cancer. It can really vary whether people are able to be cured or get effective treatment from that. And I think prostate cancer is no different in that it can affect people differently, but I will say that generally prostate cancer is one of the more slow growing cancers, and a diagnosis with prostate cancer does not necessarily mean that it's something that would ultimately make you very sick. The people have a higher risk of getting prostate cancer as they get older, to the point where I think maybe a third of men in their 70s and 80s would die with prostate cancer, but not from prostate cancer. So let me explain a little bit more about that. People are routinely screened for prostate cancer only between the age of 55 and 69. After that, once people are 70 years and older, we generally don't recommend screening them because if we were to diagnose prostate cancer, it's unlikely to grow fast enough or make them sick fast enough to be the reason that that person would ultimately die. You're much more likely to die of other causes, things like your heart or a stroke or a different kind of cancer, than you are from prostate cancer if you don't have it before the age of 70, because it generally is very slow growing. And below the age of 55, people are not very likely to have prostate cancer yet. And so we don't recommend screening until people are 55. Now, between the age of 55 and 69, you can get an annual blood test just once per year for something called PSA, that's prostate-specific antigen, but you don't need to know that. It's just a blood test. You can get it once per year, and you can track that lab value every year. Now, we consider it a positive screening that's concerning for prostate cancer if that number is really high. I got this from a group called the U.S. Preventative Services Task Force. It's a group that reviews all kinds of preventative care screenings and gives recommendations on what is advised, because it will end up saving people's lives or helping them live longer and healthier. Or it says, maybe don't do this screening because we don't have good evidence that it will cause people to live longer or have a healthier life if they get this screening. And prostate cancer screening is in an in-between kind of category. And that's because if you screen positive, sometimes that positive result can be because of something else instead of prostate cancer. And if you get a positive screen, the next step is to get a biopsy of the prostate. Now, a biopsy is going in with a very small needle and taking a piece of the tissue from the prostate and looking at it under a microscope to determine whether or not it's cancer or not. For people with a prostate, getting a biopsy in that area it's a sensitive area with lots of blood vessels and nerves, and has its own risks to get a biopsy, including causing erectile dysfunction if any of the nerves that cause erections are accidentally injured in that process. And sometimes it causes people to lose control of their bladder, again, from damage to nerves in the area while obtaining the biopsy. So, that's a lot of information that's hard to think about, hard to conceptualize. And so I wanted to use this graphic to kind of go through exactly how helpful prostate cancer screening is. So if we took 1,000 men in the general population of the United States and screened them for prostate cancer, about 240 of them would get a positive screen, a positive result. And again, this is between the age of 55 and 69. So about a quarter would screen positive. Of those 240, if all of them choose to get a biopsy, which is that small procedure to get a sample of the tissue and look at it under a microscope, of those 240, only 100 of those people would be found to actually have any form of prostate cancer. For some of those, it would be a faster growing, and for some of those, it would be a slower growing type of cancer. So of those 100, somewhere between 20 and 50% of them will have a cancer that never grows, never spreads to other organs, and never causes them any kind of harm. Of those 100 people, usually 80 of them would choose an option for treatment, which could be surgery to remove the prostate, or radiation, which is using X-rays, like X-ray beams, radiation, at the prostate to kill the tissue, basically, to stop the cancer. So by screening all of these 1,000 people down at the bottom here, you can see only 3 of those out of 1,000, by screening them and treating their cancer, do we avoid it spreading to other organs, like the liver or the lungs, or sometimes it can spread to the bones in the spine. Only 1 of those 1,000 avoids dying from prostate cancer. And 5 of those 1,000 people that had prostate cancer would still die from prostate cancer, even with surgery or radiation to treat it, because sometimes cancer is too aggressive and we're not able to treat it before it spreads to other organs. As a result of this screening 1,000 people, 50 of them would end up having erectile dysfunction, and 15 of them would end up having trouble controlling their bladder as a result of side effects or complications from getting a biopsy done. So you can see this is a very individualized decision, and it's a conversation you should have with your doctor if you're interested in being screened. If you have a family history, like your father, your uncle, your grandfather had prostate cancer, especially if it was severe and a particularly bad cancer, then you may want to get screened. That may point you in the direction of doing this with your doctor. But if you don't have any family history of cancer, you are comfortable not getting screened, then that's a perfectly reasonable decision too. We have a lot of scientists working on better ways to screen for prostate cancer that will be more useful than the current tools that we have, but it may be several years until we have those available for people to use at the doctor's office.
There's a question, is there any symptoms for prostate cancer?
Yeah, definitely. For any cancer, common symptoms can be weight loss, like unintentional weight loss. You've lost 10 pounds in the last 2 or 3 months without meaning to, without changing your diet or changing your exercise. You can have fevers or full body chills without really knowing why. And sometimes you could have night sweats, like waking up in the middle of the night, having just soaked the bed with sweat. And those things keep happening over time. Those are a set of symptoms that can be associated with any type of cancer.
And
Mhm.
Sorry. And then also you might not even have any symptom. You
Yeah.
might not notice any symptom at all too.
Yeah, absolutely. And sometimes prostate cancer can also cause problems with peeing. But so can, as everyone gets older, generally your prostate gets larger in size, which can also cause some urinary symptoms. So it's and when I say urinary symptoms, like trouble getting your urine stream started, or feeling like you have to pee a lot more often than usual, or having to pee a lot at night, like wake up from your sleep to use the bathroom. Those can be symptoms as well, but they can also be very normal side effects of getting a larger prostate as you age. So this is part of why prostate cancer can be hard to diagnose.
Then next question is, does it affect all men the same or worse for a specific group of men?
If that question is directed toward if you have a specific group of men in mind, then feel free to chat as well, what kind of group you're asking about. But generally, prostate cancer, in some men, it's very aggressive and it's a fast-growing cancer. But in most men, it's very slow. It's not one of the more dangerous types of cancer, but it can affect every individual differently. I would say that there's no particular group, like no particular
With
group.
older men. I would say, yeah, older men with age,
Mhm.
any type of cancer, including prostate cancer, is gonna increase the risk. Yep.
Yeah. And that's really the only group that comes to mind, just being older.
Yeah.
Being overweight or having a larger body size does not convey an increased risk. It does not mean that you're more likely to have prostate cancer.
What is the difference between blood test and finger exam? Oh, that's a great question.
Good question. Good question. Yeah. So the finger exam is what we call a digital rectal exam. It means putting a finger inside to feel the prostate. The prostate is located right in front of the rectum. So sometimes your doctor is able to examine the prostate by doing that exam with their finger, which can be a sensitive exam as well. I do want people to know that we do it all the time, and we want to make you or help you feel as comfortable as possible if that exam is ever needed. Both can be useful tools in diagnosing prostate cancer, but I think the screening test with the blood test is usually more recommended to be routinely used, regardless of whether you are having symptoms concerning for cancer or not. You can do the annual blood test. The finger exam, used to be something that we did a lot before we had this blood test, but now we don't have good evidence. We don't have studies that show that routinely doing the finger exam helps diagnose prostate cancer if you're not having symptoms. If you are having symptoms, we may suggest doing the finger exam because we could feel if the prostate is large, but it's still the normal shape. It's still very round. It's just larger than usual. Then that usually suggests that you may not have cancer. You may just have a larger prostate that's causing trouble peeing. But if we do the finger exam and we can feel on the prostate, there's like a bump on one side, or it feels really bumpy, like there's a lot of different spots on the prostate, that's just kind of concerning. It's not very smooth in shape like it's supposed to be, then that raises my concern for something like prostate cancer. And then I would suggest getting the blood test. That's a great question.
Yeah. Amazing.
Okay. So those are kind of the main points that we wanted to talk about today in the time that we've had together. I know we've been talking for just about an hour, and I just wanted to know, from everything that we have discussed, what are some of your takeaways that you have learned today, and you can take with you in your conversations with your friends and things to talk about at future father support groups.
All right, thank you, doctors. We really appreciate your time today, and it was a very, very beneficial presentation. We really appreciate it. From the exam routine, from the STD testing, from the prostate screening, and in general the depression. You have done a great job, and for me, I will ask the participant. It was very, very beneficial, and we took away a lot from this presentation. And there's a chat person.
Maybe about sharing
Oh
slides.
yeah, someone is asking if they can get the presentation slides. This will be recorded and uploaded into the organization's YouTube page. You can rewatch, and you can take notes if you would like. The person that's asking, I was just giving that to them.
Yeah. And Elias, I'm happy I can send an email to you with a copy of the slides, and you can send it to that person or to everybody if you'd like to share.
That would be great. Yeah, thank you. And everyone, I just put in the chat the link to your stipend that you can fill out, and please make sure that you don't share with anyone that wasn't within the presentation, and we appreciate you. Yeah. Any questions, please feel free to ask the doctors while they're here.
Yeah, we'll stay on for a couple minutes.
Thank you.
I have a question, doctors. Thank you. I stepped away for a minute. I'm not sure if this was included in the presentation on prostate. I was wondering, does it have anything to do with, like, if someone is sexually active, if they're not sexually active, does that have, or their level of sexual activity, does that have anything to do with getting a prostate or being more susceptible to getting?
No.
Yeah. Go ahead.
Yeah, typically not. I will say some patients, if they have what's the word I'm looking for? Like ejaculation before the test, that can affect the test. But otherwise, like the PSA test, not really the finger exam. but otherwise, not that I can think of.
Yeah.
Yeah, someone is asking if the infection, the STD infection, is not treated for a long time. Is it possible to cause any problem with pregnancy or labor?
Yes, definitely. So if the infection goes untreated in someone that is carrying a pregnancy. Yeah, okay. Definitely can cause effects with pregnancy and labor. Actually, if someone has an infection at the same time as being pregnant, that can cause them to go into labor early, and for the baby to be born early. That's why we routinely screen people for sexually transmitted diseases and for a urinary tract infection. We make sure that there isn't a lot of bacteria in their urine, and treat those infections early in like the first trimester to avoid causing early labor. If a baby is born while there is an infection like gonorrhea, for example, or chlamydia, that can be passed to the baby through their like their we call it the mucous membranes, but through their mouth, their nose, and their eyes. And particularly, I don't know if anyone has heard of this before, but sometimes babies can be blind if they are born and the parent had chlamydia, and then they get chlamydia in their eyes, and if it goes untreated, they can be blind. Which is actually why we treat all babies with an antibiotic ointment in their eyes right after they're born. Even if the parents were screened for chlamydia or treated for chlamydia and they don't have it anymore, we still treat all babies with that antibiotic ointment in their eye, because it's something that we can easily prevent, but has really significant consequences of causing blindness for life if it goes untreated.
Yeah. So if your baby has the ointment, it doesn't mean that we don't trust you or that we don't believe you. It's just something that is the standard care here, and it has nothing to do with judging you or anything like that.
How much would you recommend testing a potential partner? There is like some people who are afraid of coming off as something, judgmental or something bad when they ask their new partner, whom they don't know what his prior like sexual life was. How would you recommend those people to tell them to test themselves before partnering up with them?
Yeah, that's a great question. Generally, I recommend people get tested once per year if they are having new sexual partners. If they're having sex with multiple partners or multiple new partners more frequently, like having 3 or 4 or 5 partners in a year, then maybe they could get tested more often, like every 6 months. So that's a pretty individualized decision, and it's a great question to talk about with your doctor, to apply, a schedule of screening to your specific person, to you specifically. It can be really uncomfortable to talk about sex and talk about sexually transmitted diseases with a partner. You're absolutely right. I think doing it earlier and doing it as part of a routine conversation helps kind of reduce that shame and the judgment that people can feel. I think if you're wanting to get tested or you're wanting a partner to get tested, it can help to frame it by saying, well, first of all, you can say these doctors at Swedish recommended it. But you can say, this is something that I want to protect both me and you, I want us both to stay healthy, and I want to do this to help protect you, if I had anything as well. And you can say I do this with all people, with all new sexual partners, or with all new relationships. It's not specific to you. Similar to what Jaime was just saying about the ointment in people's eyes, you can say, it's not that I don't trust you. It's that sometimes I know people can have infections and not know it. And that's why I want you to stay healthy. I want me to stay healthy. And so I do this every time I have a new relationship. And just say that it's a standard thing that you do in your life. And it's not because of having a relationship with that person specifically, or because you think that they might have an infection specifically.
Another strategy can be coming together to the appointment, and some people might want like a very like standard neutral setting to discuss those things, and so bringing your partner to the appointment can also be helpful, because we can talk about the risks, the benefits of the disease and getting tested. So that might be another strategy you can try.
That is,
Another great question.
yeah, thank you. That's really helpful. And I think we don't have they said thank you so much for your presentation. The community and the members really appreciate your thorough presentation and great answering those questions for them, and we appreciate it. We hope to have you again for further presentations, doctors. Thank you so much.
Good. Thanks for having us.
Yeah, thank you. We'd be happy to talk again. And thank you everybody for your participation and sharing your questions. It makes it really fun to talk to you guys. And we would be happy to do it again.
We appreciate you. Thank you so much. Zainab, would you like to say anything?
Yeah, thank you. No, thank you so much, doctors, for coming through. This is such an insightful session, and I definitely hope that we can make it just like for the moms group, like every other. We meet quarterly, so if that's something that will work for you, really appreciate that.
Yeah.
We will stay in touch.
We will stay in touch. Yeah. Thank you so much. Nice to meet you both.
Thank you, everybody.
Thank you so much.
Thank
Yeah.
you.
Bye-bye.
Bye-bye.
Bye, guys. Thank you.